occupational English test. The test is being held in FLC. The candidate number is 039 and the candidate name is Ms. Roach.
Yes, that's correct.
The interviewer is Mr. Cass and the interlocutor number is 123456. The role play number is 1 and 2. The profession is nursing. Good afternoon.
Good afternoon.
My name is Cass. Can you state your full name?
Yes, my name is Furuj Iftihar.
And what's your candidate number?
It's 039.
Great. So you are taking the test for nursing, is that correct?
Yes, that's correct.
Great. Thank you. Can I see your documents, please?
Yes, these are the documents.
Thank you very much. Alright, so please confirm your details are correct on the test paper and then read and sign the candidate's declaration on the front of your booklet.
Okay.
So you can read that. Okay.
Okay.
The moment questions are not assessed, so it's chance for us to get used to each other's voices. We'll just talk for 2 or 3 minutes. So I'd like you to tell me about your professional background. So why did you decide to become a nurse?
Well, I think nursing is a very generous and a very humanitarian kind of profession in which we get so many chances to work with the people who deserve care and who deserve our sincere efforts. So this was my reason that I chose this profession, because it was not only career, rather it is very close to humanity.
Alright, so what do you think, what capabilities should be there in a candidate to become a nurse?
There are a plethora of qualities that a nurse should possess, among which I think the very first would be a considerate ear. Like a nurse should be paying complete attention to her patient's desires, requirements, and what are the needs. Besides, she should be empathetic and have a greater level of sympathy. Last but not the least, she should be courageous. Okay.
Alright, so what do you think the robots who are performing the surgeries will replace the human nursing a lot?
Well, they are just assistants for the human nurses, and I don't think that they can have that compassion and sincerity towards the patient which a human nurse could have.
Okay, thank you very much. Let's move on the role play now. So I'll take the part of patient or perhaps a relative, and you take the professional role. So each role will last for 5 minutes, and the purpose of role play is to get evidence of your ability to communicate effectively with patient. Use your ability to fulfill as much role play as possible.
Okay.
So do you have any questions?
No.
Excellent. So you have up to 3 minutes to prepare the first role play, and you will start the role play after the time you will know. When 3 minutes the time are up, you will get to know. You can ask me if there is anything you are not sure about, and make notes on the role play card if you want to. There is a pencil for you, and also this is the information for first role play and the role play number 1 for the profession of nursing. Please start preparing now. That's your card. You have. Thank you very much. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play now?
Yes, sure.
You can start.
Good morning.
Good morning.
My name is Furuj, and I'll be your attending nurse in this hospital ward. For the record purpose, may I reconfirm your date?
My name is Cass, and you can call me Cass.
Okay, Cass. As this is the second day of your surgery, and you had the surgery for the removal of partial thyroid gland, so how are you feeling today?
Actually, I'm not feeling that fine today because I am having pain whenever I swallow something, and whenever even I breathe, I feel pain, and I don't know that what's happening.
So sorry to hear about that you're suffering from a lot of pain. I give you a pain scale, can you rate your pain on that? If 0 is no pain and 10 is the maximum pain you have ever received, so where is your pain right now?
You can say it's on 6, but it's a kind of pain that I haven't felt before. As I told you that whenever I swallow or whenever I breathe, I feel pain.
Oh, so sorry to hear that you're having this much pain. Are there any further concerns beside your swallowing and beside when you are speaking? Is there any further concern?
Yes, actually, I am a teacher and I'm really much concerned about my voice. So I want to know that when I'll be on normal routine.
This is very considerate of you to think about such questions. So, Mr. Kels, let me tell you one by one related to your problems. As you mentioned that you have a problem with swallowing. So, before proceeding further, I would like to know what have you taken in the breakfast in the morning?
Actually, I took juices.
Okay.
And that was prescribed by the doctor and that was provided by the hospital.
Okay. So, as you have been allowed to have some liquid kind of diet, so this problem of your swallowing would be settled within 2 to 3 weeks completely. As you had undergone through the partial thyroid gland surgery, which is done near to your throat. So this is the reason that you are feeling difficulty in swallowing. But after a day or two, you can move towards the semi-solid diet and can have porridge, custard, or yogurt. And with the doctor's instructions, you would soon be back to your normal diet. Are you getting me?
Yes, I am getting you.
Okay. And the second issue you have mentioned is related to your voice, and you said that you are in a very noble profession of teaching, which I truly understand that your voice must be very valuable for you. So, Mr. Cass, as I mentioned earlier, that within 2 to 3 weeks, all your problems will be settled down. So, even your voice would be back to the normal. How does this sound?
That sounds really great.
Okay.
And it's comforting.
Yeah, but meanwhile there are certain things which you have to follow. Like when you are, like first of all, you don't pressurize your vocal cords. Like for at least 2 to 3 days, if you need anything, try to write it down on a paper, or you can also use your mobile phone and you can send a text message. And of course, this is a bell that is near to your bed. You can ring the bell if you need a nurse's assessment or a nurse's help. So she or even I would be there within no time. So meanwhile, just speak less and let your throat relax. So how does this sound?
That sounds really great.
Okay. So do you have any further concern apart from swallowing or this issue of voice?
Actually, I'm worried about my swallowing condition because I'm having difficulty in swallowing. So, would you tell me that why don't you put me on IV drips? Because before the operate, I was on IV drips and that was really comfortable for me.
Well, your question is really commendable. And I really like that you're very concerned about your health. But IV drips are for the people who are unable to eat anything and being shifted onto this liquid or semi-solid diet after your doctor's consultation. And he has seen your case notes and he finds it that you are appropriate to shift towards the liquid diet. So, as I said, if you will stress your vocal cords less, even your swallowing will get better. And try to take some warm kind of liquids like warm milk or coffee. This will really help you to recover soon. Are you getting me?
Yes, I am getting you. Thank you very much.
Thank you.
Okay, really well done. All of that was good. So one or two things that I want to mention. First of all, इसमें sympathy, empathy और sympathy कह लें, empathy कह लें आप, और appreciation, और आप patient को जो calm down करते हैं, मतलब patient worried है, that's really important. और second important thing is the paraphrasing. जब आप patient की ही बात को repeat करते हैं, उससे active listening भी होती है, उससे paraphrasing भी होती है, उससे आप respectful attitude भी शो करवाते हो, और उससे एक summary भी होती है. So there are different things. So ये दो points लाजमी ऐड करें, क्योंकि इसमें आपने पेशेंट को डायरेक्टली डील करना होता है. इट्स नॉट द कन्वर्सेशन. ऐसा नहीं है कि सिर्फ कार्ड की इंफॉर्मेशन को आप रीड आउट कर दें. तो क्योंकि ये पेशेंट लीडिंग है, तो पेशेंट को हर पॉइंट पे सिंपथाइज करना होता है, हर पॉइंट पे आपने उसकी बात को रिपीट करना होता है, देन यू गेट द गुड स्कोर। और इसमें वन मोर इम्पोर्टेंट थिंग, जैसे मिस कर रही थी, मुझे थोड़ी इन्फॉर्मेशन बता के दोबारा अश्योर कर रही थी, ऐसा नहीं था कि वो बस कुछ कैंडिडेट्स बोल ही जा रहे होते हैं। तो अगर आपको लगे आप 10 से 15 सेकंड से ज़्यादा बोल रहे हैं तो चंक एंड चेक करें, अपनी इन्फॉर्मेशन को ब्रेक डाउन करें और फिर पेशेंट से अश्योर करें कि वो आपकी बात सुन रहा है एक्टिवली कि नहीं सुन रहा। ठीक है, दीज आर द सम मेन पॉइंट्स, ऑल वी डिड वेल।
So, last but not the least, I would like to add one thing which I found is really helpful in making a conversation more realistic is the use of the non-verbal gestures. Like when the guest was telling me about his problem, I was showing concern with non-verbal gestures like okay. So these are very much natural and it keeps the role play natural. Because at the end of the day, what is getting assessed is not your face. So आपकी आंखों में चाहे आंसू आ जाए अपने पेशेंट की बात सुन के, but that is the voice that is being assessed. So this is the thing which you have to do.
So you keep that in mind कि आपका पूरा सेशन ऑडियो रिकॉर्डेड है और पेशेंट सेंटर्ड है। Alright.
Thank you.